Everyone, it's Dr. Erica Person with Flex Audiology, and today we're going to talk about phone apps and which ones can help you relax with tinnitus. So, are you struggling to relax because of your tinnitus? There's an app for that, most likely, and actually there's probably several. So we're going to talk about the best tinnitus and relaxation apps that are currently out there that can help you calm your mind and support your recovery. But first, if you could do me a favor and hit that subscribe button and hopefully the up button, because it's provided you with great information, that really helps a couple things. It helps spread our awareness to the community about tinnitus. And also, as we get new videos, you'll get a alert that we've got a new video out. And so you'll always be updated. So appreciate that. So let's talk about these apps. Apps can be helpful. The tinnitus can often feel louder when you're stressed out and you're just simply trying to relax. Many of my patients come in and tell me, I really don't notice it until, let's say, I get out of work, I'm in my car, it's quiet, I'm heading home, I'm trying to decompress, and that's when it's the loudest. Or you're lying in bed, you're trying to take a nap maybe on the couch, and it's quiet, and that tinnitus is just super loud. So what does the app do? Any of the relaxation or sound therapy apps, they help distract your brain from the tinnitus. They can help lower your anxiety and stress levels. We know that anxiety and stress typically will peak or make your tinnitus seem greater than what it is, or it's for some people, it really does make it get a lot louder. And it can also help improve your sleep. And improving any type of sleep hygiene also helps lower the perception of tinnitus as well. And so here are kind of my top tinnitus and relaxation apps. You have the Resound Relief. It features customizable soundscapes. It's got a guided meditation in there. It's got breathing exercises. And you can also kind of layer the sounds and then save your favorites. So that one's a good one. And then an oldie but a goodie is the Widex Zen Therapy app. This has been super popular forever. It uses I say forever, but it uses the musical tones, relaxation exercises based on the Widex Zen Therapy model. And so it's great if you're already using Widex hearing aids for that, but on its own, it's got a nice variety. And then moving into some of the more of the paid advertising apps, you've got your Tide or your Calm. You've probably seen the Calm on TV with some of the commercials. That focuses on sleep and mindfulness, and it includes sleep stories, guided breathing, nature sounds. Another app is called My Noise. It's really a highly customizable ambient noise generator. It's ideal for masking specific tinnitus tones with really kind of natural sounds. It's a good app. I'm not necessarily a huge fan of masking out tinnitus, but if I had to pick masking tinnitus in order for you to get to sleep really well, then I'll pick my battles. So that's a good one for that. Better Sleep app that combines sleep tracking with the soundscapes and bedtime routines, and it tracks kind of your trends in your sleep, and that can also affect how your tinnitus can fluctuate as well. And then really my favorite app, I saved it for last, is the Odo app. That's my current favorite. We use it here in the clinic. We utilize their treatment program. It's a 12-week-long treatment program. There's a video I have out specifically that does a deep dive more into what that app encompasses. But there is the app that's available on the consumer side versus through the clinical side. And it offers high-level CBT-based lessons, breathing techniques, sound therapy as well. But the treatment program that is available on a clinical side is much more in depth, and it's a 12-week-long treatment program using CBT. So take a look at 2 videos, one specifically regarding the Odo app and one video specifically talking about cognitive behavioral therapy treatment, which is the CBT. So here's just some quick tips on how to use these apps effectively. You want to use them regularly. So the more relaxed that you can be, and not just when your tinnitus spikes, the more consistent you can kind of keep your body calm. super helpful in using it for a bedtime routine. So that will help you ease into sleep. Again, you don't want to be on your phone per se before sleep. So right before you go to bed, use of your phone for a lot other than just listening to some calming sounds, things like that, that would be beneficial. And then if you can either use headphones or Bluetooth hearing aids, more of that immersive sound quality, that would be ideal. And then just being careful not to overmask. So keep the volume low, keep it comfortable. And when I say headphones, I really like the bone conducted headphones, nothing that really blocks up your ear. You just kind of have to be careful. Some people report that they get headaches if they have things too loud. So when I say a low level, keep it low. And then really pairing these apps with professional care, someone who has been trained in tinnitus treatment. So a lot of these apps can be used alongside a personalized treatment program, and a trained provider can recommend really the best app depending on your tinnitus profile and teach you how to integrate it into your daily life. So what is a tinnitus specialist? A tinnitus trained specialist is somebody who has gone to additional training. They have gone to classes, they've gone to courses, they've been through CBT certification, they are using biomarker tracking. It's so important when we look at tinnitus that we're not just looking at the tinnitus signal itself, we are looking at really your whole being. So that's your heart health, your heart rate, your blood pressure, oxygen saturation, your exercise. We want to look at your sleep hygiene. I keep bringing it up, but it's so important to being able to decrease the impact that tinnitus has on our life. A tinnitus trained specialist will use best practices when they're testing your hearing, or in the event that you have to use hearing aids or some type of sound therapy generator. They're going to use real ear measurements. They're going to use test box measurements. They're going to test you speech and noise. They're going to test your tinnitus pitch and masking and how you react to it. They're going to use questionnaires. And then really they should be utilizing a comprehensive treatment plan, not just devices, but looking at CBT, looking at tinnitus retraining therapy. Biomarkers, I brought that up. If you're not familiar with those you probably already have one. Some of them are built into the hearing aids themselves, and almost like a Fitbit or an Apple Watch, or we use our own biomarker ring in our clinic. So that's all unbelievably important. Apps are a great tool for you to use, but they're best when they're worked alongside kind of a guided by a tinnitus trained specialist who knows how to pair that within that therapy program. And if you're not really sure where to start, the first thing is maybe just go in for a tinnitus consultation. Now, if you end up at a place that the audiologist or the hearing care dispenser, their only offering is devices with a masker, you're probably not in the best place. And so I would encourage you to reach out and find someone that has done additional training. There are certifications, the CH-TM certification, and you can go on the American Tinnitus Association, and that will help also vet out some of these people as well. So good luck in looking at some of these apps. And I have to say, these apps change all the time. So these are my top ones now. It could change, some of them might be defunct in a couple months. You just really never know. So one of the sites and resources that I like is if you go to the American Tinnitus Association and you go under the professional support, they usually have a list of the most current apps that are available. And don't recreate the wheel. Take a look at those, go through some of them. And, one of the newest ones I debated putting on here is also called the Tinnitus Therapy Lite. It's called the Sound Oasis. I brought it up on my phone. I like it. The free version gives you some options. And then if you get into the paid version, they can really get aggressive. So lots of stuff out there. Drop me a line. Tell me what your favorite apps are. Tell me which ones work best for you. I'm really curious. I'm always open to trying different things in our clinic. And until the next video, hope you guys have a great day.